So good afternoon, ladies and gentlemen, supporters and partners. It is my privilege to welcome you to the American Red Cross Southeastern Pennsylvania region's signature virtual speaker series entitled Blood Saves Lives, Fighting COVID-19 and How You Can Help. Our wonderful presenters today have served the Red Cross for a combined 39 years. Helen Muniza, our Regional Donor Services Executive for Biomedical, has been with our organization for more than 21 years. Lynn Householder-Glenn, our Senior Manager for Blood Services Fundraising Programs, has been with the Red Cross for a little over 18 years. We are so grateful for their service to our life-saving mission and their time today to discuss this very important subject. Before I turn it over to our presenters, I would like to share a few participant tips with you. Please stay on mute to reduce echoes and background noise. If you hear an echo, please lower your volume slightly. To keep our presentation within the allotted time, we will not have a live question and answer session. So please feel free to email your Red Cross contact that invited you to today's session with any questions or requests for more information. Thank you, and without further ado, I would like to turn it over to our presenters, Helen Muniza and Lynn Householder-Glenn.
Thank you, Joy, and thank you to everyone for participating in this event today. Every 2 seconds, someone in the United States needs blood. During a global pandemic, the needs don't stop. Patients that are battling cancer or have heart disease still need blood products. Children that are fighting sickle cell disease still need blood products. If there's a mother in a hospital giving birth and maybe having complications during that childbirth, she still is going to need blood. Premature babies were being born, since this pandemic started, and some of them have needed blood. People are recovering from accidents or in emergency rooms needing blood. So the demand for blood does not go away, even though we were in a pandemic. As you can see here, there's a picture of Ryder on the screen. Ryder was a 3-year-old diagnosed with a brain tumor. The doctors removed the tumor from his brain and then treated him and used blood products to help him. He is now a 5-year-old lively young man and alive because of the blood products that were there for him when he needed it. Next slide. So let me bring you back in time to mid-March. It feels like a lifetime ago, but it really was only a couple of months. But right around mid-March was when it seemed like the world just started to change. Things were collapsing all around us, whether it was in our personal life or our work life. So I want to talk a little bit about our community and what happened to the blood supply in the middle of March. Back then, we thought, that businesses were going to be closed for about 2 weeks. Schools were being canceled. They were saying, come back in 2 weeks, everything will be fine. Elementary schools, high schools, colleges were closed. Businesses, were saying, oh, work from home for a couple of weeks. And at that point, we were concerned locally about what were we going to do for 2 weeks to make sure that we provided the blood that were needed by our hospitals. And many of our blood drives in our community are sponsored by businesses and by schools. So we lost blood drives in our community, and then across the country, as you see on the slide, we lost about 5,000 blood drives by March 19th. And that was just back then. So we've lost thousands more since that time frame. And we needed to, of course, come together and figure out how we were going to book new blood drives with new sponsors to collect blood that we need for our communities. Next slide, please. Luckily, when the blood drive started to cancel, many members of the community and leaders across our country stepped up to help the American Red Cross, and we're so very grateful for that. We really needed it. The Surgeon General, as you can see his quote here saying, you can still go out and give blood, was really helpful to us, in addition to political leaders, community leaders, partners from the American Red Cross that got out there to try to share that message that, yes, you are being told to stay in your house, but you are allowed to come out to donate blood. And we actually need you to come out to donate blood to help to replenish the blood supply. Next slide, please. So the need for blood doesn't stop during a pandemic, and neither does the Red Cross. The Red Cross is there in the background, working hard throughout this pandemic to provide all the services that we provide for our community. Next slide. About 500 blood drives are run each day around the country with the American Red Cross. And as I mentioned, we work with businesses and high schools and community groups and churches and synagogues to sponsor blood drives. During the pandemic, many of those locations were told that they weren't allowed to be open only if they were an essential service. So it wasn't that our businesses and our partners and our schools didn't want to sponsor blood drives. They did, but they were not allowed, or they thought they were not allowed. Luckily, during this time frame, we were able to get approval to run blood drives, of course, because we are an essential service, and then encourage donors to come out to those locations. Next slide, please. So safety, of course, that is our top priority. As I mentioned, we were looking for locations for blood drives and for groups to sponsor the blood drives. Then we had to transition into what are we going to do now to make sure that our blood drives are safe when those blood donors arrive to donate blood. So we had to adapt and adjust to make new protocols at our blood drives and at our donor centers. We added temperature checks. So as a blood donor arrives on site, we check their temperature. We added face masks for our staff, for our volunteers, and we asked the donors to wear face masks. We set up our blood drives a little bit differently. So if you donated at a community drive back in January and you go to that same location today, it's going to look a little different with how the beds are set up and the chairs and things, because we need to accommodate social distancing. Also, we added more hand sanitizer to our blood drive operations, and we are doing disinfecting surfaces more than we did maybe in the past, or differently, to make improvements. And we're continuing to make all the improvements that we can to make sure that the donors, the volunteers, and the staff are safe when they come out to give the gift of life. Next slide, please. So keeping the blood supply safe, obviously, is extremely important to us. And at the American Red Cross, we are very proud to be a part of the medical community. We partner with health professionals. We work on vaccines. We work on programs with companies that are doing research, and we're very proud of that, and we continue to do that. For every blood donation that is given, we test at least, well, we process it with at least 10 tests. And right now we actually added an additional test, which I want to talk about. Next slide, please. So starting on June the 15th, we started testing blood products for the COVID-19 antibodies. The antibodies show up in a person that had been exposed to the virus, and their body had a response to that virus. Next slide, please. So for the antibody testing, we will be doing this temporarily. We started on June 15th. We will be doing it for a few months, and it's a temporary test that we'll be adding on. The reason that we're doing this is many people in our community are very curious. They are not sure if they've been exposed to the virus, and they're curious to see if their body has a response to it. So by giving them the opportunity to come in to donate blood and then find out if they do in fact have that antibody, it's really been a great thing for our blood donors. It's just an added benefit for them to find out something they're very curious about. And what we found since we implemented this test is that we're seeing a lot of donors come out that maybe haven't had the opportunity to donate recently, maybe they haven't donated for a few years, and we're also seeing a lot of first-time blood donors. We are thrilled with the response from the community of people that want to come out to do something good, to share their good health, to come out and donate blood to help us, especially during this pandemic. Next slide, please. So the need for blood doesn't stop during a pandemic, and neither does the Red Cross. We will continue to fight in the background to figure out how we need to change, how we need to adapt so that we can continue to provide the blood to the patients that need it, and to provide a safe environment for our blood donors, our volunteers, and our staff. Next slide, please. Convalescent plasma. So during the pandemic as well, we were asked to collect convalescent plasma. So this is a brand new product for us, the COVID-19 convalescent plasma. And this product is donated by a person that is fully recovered from COVID-19. So the person is exposed to the virus, their body produces antibodies that fight against this virus. So next slide, please. People that can come in and donate this plasma, because their plasma has the antibodies in it, they are able to help people that are very ill with this disease. On the screen here, you'll see Tammy. Tammy was the first person in the American Red Cross to donate this plasma during the pandemic. And Tammy actually donated over in New Jersey, so not too far from our Philadelphia office. Tammy was infected with the virus and recovered completely from the virus. A family member needed plasma. The doctors were asking for it to help her aunt. Tammy wanted to help in some way and helped in a very, very special way. As I said, she was our first plasma donor across the country, and she came in, donated her plasma, helped her family member, and then also was able to help another person that was severely ill with COVID-19. This product is expected to increase. And when I say increase, I mean the hospitals and the physicians continue to request this product to help their patients that are suffering. That means they are asking us to collect more convalescent plasma. So we are looking for people that have recovered from this disease and are willing to come in and donate plasma to help those that are in need of it. Next slide, please. The need for blood doesn't stop during a pandemic, and neither does the Red Cross. You can count on us. We will be there to continue to adapt, and as I just mentioned, add additional blood products and work with the medical community to help these patients in need. Next slide. So now I wanted to bring you along the journey from the blood donation all the way to the patient. So if we think about Tammy that I was just talking about that donated her plasma. So Tammy went to our donor center, donated her plasma, and then we transported that plasma from that donor center to our facility. When the blood arrives at our facility, we do tests on it, at least 10 tests. And as I mentioned, we do the additional test right now for the antibodies. We process that blood and we prepare it for distribution. After that point, we bring that blood along to the hospital that is requesting it. And that blood product is put into the blood bank at the hospital, so it is there and ready to be transfused into a patient when they need it. Next slide. So we are an essential service at the American Red Cross. We're a 24/7 service, 365 days a year. We never stopped. Many businesses closed or shut down temporarily, schools closed. We did not. We are there. We have our nationwide network there standing ready to serve the hospitals so that we can help the patients in need. We have about 70 distribution centers across the country. We have over 3,000 vehicles. Our vehicles are driving all around the entire country to provide the blood to the patients when they need it. We stand ready. Next slide. So the need for blood doesn't stop during a pandemic, neither does the Red Cross. There's so many things that we do behind the scenes so that the community can depend on us and not even really think about, a worry about the blood supply. We want to be there to supply the blood for it to be there so that when your friend or loved one arrives at the hospital and needs that blood, that product is already there and ready for them. Next slide, please. So our mission at the American Red Cross is to provide blood for the patients that need it. We will be there if there's a cancer patient that is going through chemotherapy treatment and needs blood. We will be there if there's a premature birth and that baby needs blood. We will be there if there's a trauma, a horrible, horrific accident that happens and someone needs blood. We will be there. If there is a patient that has sickle cell disease and needs a transfusion, we'll be there. You can count on us. Next slide. So I wanted to share the story about Braden. Braden is a young man that suffers from sickle cell disease. As a 3-month-old, he was diagnosed with sickle cell disease. When he goes in crisis, he suffers a lot of pain. He has strokes, and during that time frame, part of his treatment is to receive blood products. The blood products need to be there when a crisis occurs for Braden and people like him. So we need to make sure that the blood supply is maintained, is sufficient, the blood is actually in the hospital and ready so that when Braden and his family arrives and needs that blood transfusion, that it's there. Both Braden, his mom, Brenda, his whole family, his friends, his neighbors, everybody is grateful for that blood for Braden so that he can survive and thrive while he fights this awful disease. Now I would like to turn it over to Lynn. Thank you.
Great. Thanks, Helena. Thanks for that incredible information. I know I learn more all the time about this part of our mission. I'm really excited to be with you all, sharing just how you all, in terms of financial supporters and our blood donors, really help give fuel to our blood mission. If we could go to the next slide. So as Helen mentioned, the need for blood is constant. If you don't know, every 2 seconds, someone in this country needs blood or is receiving a blood transfusion. And I think the important thing to point out here is that blood can't be manufactured. You know, it's not something we can just pull off a shelf and continue to create. It has to come from a volunteer blood donor. And the support of our supporters help ensure a safe and stable blood supply, which is especially critical during this time while we're living in a global pandemic. As Helen mentioned, we're an essential service and really a critical part of our nation's healthcare infrastructure. If you could go to the next slide. What you'll see here is, you know, Helen mentioned we supply 40% of the nation's blood. And so to do that, we have to maintain a complex and costly operation. So I thought I would take a minute to walk everybody through that operation using the image on the right. Just so you know, each unit of blood we collect touches each one of these 6 spokes on the wheel. And so within those spokes, we do fundraising to support the cost to maintain those efforts. That includes, you know, in the collection space, for example, we're right now fundraising for some cutting edge technology in scales that weigh the blood as it's collected. There's technology out there that does that most efficiently. And of course, we care so much about that gift of life that our volunteer blood donors are giving that we want to take absolute best care and collect that blood efficiently. So that's a project that we have underway. If you move on to the processing and testing spokes in the wheel, we do have advanced medical equipment that we use to process the blood, things like centrifuges that separate the blood into components that hospitals use on patients, and other pieces of equipment in our testing facilities. And then if you move on to storage, we've got freezers, blast freezers, incubators. Once we get all that blood tested and processed, we want to make sure that we're keeping it stored safely so that it's ready to go when it's needed. And then lastly, there in the hospital delivery spoke, We, of course, call on our fleet of vehicles to deliver blood when it's needed and requested by hospitals and medical centers, and sometimes that is on a very urgent basis. So this mission does run 24/7 and is really powered by your support. If we move on to the next slide, in addition to your financial support, we wanted to share some ways that you can, other ways that you can impact our mission. If you can, consider hosting a blood drive. We do have a whole team of experts and support staff that make that a really easy process. And as Helen mentioned, we're always in need of blood drives, now even more so. If you're eligible, consider donating blood and or sharing that need with your friends, family, and social networks. And if you're a blood donor, I would encourage you to download our blood donor app. It provides a wealth of information. It actually tracks your unit of blood from the time you donate through those spokes on our wheel, all the way into providing you a push notification when we send that blood to a hospital. It'll actually tell you what hospital and in what location that's sent to. So real-time impact reporting, you really feel the impact of your support of our mission in that way. Those are all the slides I have, so I know I'm going to turn it back over to Joy, but really appreciate your support. Thank you all so much.
Thank you. Thank you both. I appreciate both you and Lynn and Helen for coming. I just would like to thank our presenters and all of you for taking time out of your busy personal and professional schedules to join us today. I hope that you can join us for our next virtual speaker series on August the 12th, entitled Episodic Disaster Activation and Supply Chain Management. Again, please feel free to email your Red Cross contact that invited you to today's event with any questions or requests for more information. Thanks again for joining us and have a great day.
Thank you.